Good morning, everybody, and welcome back to AL.com series of COVID-19 town halls presented by AARP of Alabama. In this five-part series, we're bringing you an expert panel each week to talk about a specific topic and how coronavirus has affected that topic in our daily lives. Today, we're focusing on healthcare. I'm your host, Ivana Harinkyu, and this is my expert panel today, two faces that are probably very familiar to you by this point. I am joined by Alabama State Health Officer, Dr. Scott Harris, and UAB infectious disease expert, Dr. Michael Saag. Now, also part of our expert panel is another UAB infectious disease specialist, that is Dr. Leticia Elopre. Dr. Elopre is going to be hanging out in our comment section and answering medical questions you might have, such as, can I get vaccinated if I have a specific allergy? How long do I need to wait to be vaccinated after recovering for COVID-19, and more? If you have those questions, drop them in the comments here, and Dr. Elopre will answer those. Now, both Dr. Harris, Dr. Saag, thank you for joining us today, for taking some time out of your lives. I know you're both probably busier than ever. We have some really great audience questions I want to get into, but first, I want to ask you each just a very generic question, and that is, how is it going right now with COVID-19? Dr. Harris, I'll start with you.
We're still in a pretty difficult situation in our state. You know, we're a little better than we were 3 or 4 weeks ago, just in terms of the number of people in our hospitals, but it's not that we're in a good situation at all. We still have our ICU capacity completely maxed out. As of this morning, we have about 40 more patients in Alabama who are receiving ICU care, critical care, than we have actual ICU beds. So that means these are patients who are critically ill, and yet they're being held in an emergency department. They're being held in a place in the hospital that doesn't usually care for critically ill patients. And so it's a really difficult time. The total numbers of patients in the hospital have plateaued the last week or so. They're even declining just a little bit, but we're a long way from being out of the woods. And, we're still having double-digit numbers of deaths every day. And the tragedy of that is just that we feel like most of that's completely preventable.
Yeah, I agree. And I would argue that this is the worst we've ever been, mostly because 90% of the deaths, 95% are totally preventable. And that's, to me, tragic. I keep imagining, how are people going to look back at this epidemic 10 years from now? And all I can say is that we collectively are not responding well at this moment in time, because we have a vaccine that can completely prevent, unless you're immunocompromised, serious illness and death. It's uncommon for somebody who's fully vaccinated to end up in the hospital. And if they do, then it's unlikely that they're going to die. So the majority of the deaths, the majority of the ICUs are filled with folks who have made the decision not to be vaccinated. And that, to me, is a tragedy. And the second thing is the secondary effects of the ICUs being filled. And we saw a case out of Coleman that's been in the news about a gentleman who came in with a heart problem and had to look at 43 places before he could get care in Meridian, Mississippi, and ended up dying. He might have passed away anyway, but the fact that they had to spend that effort trying to get him to a hospital. And I heard last night about a guy who had a ruptured bowel, which is a medical emergency. There was no ICU bed there. They had to shop to find another place. And by the time they got this worked out, 11 hours later, he had passed away. So we're going to hear more of that. And that's where decisions made by a single person to say, I'm not going to participate, I'm going to choose not to get vaccinated, has impact on other people down the road. And I'm afraid we're going to see more of that in the next month or two.
You make a comment, Dr. Saag, about maybe this being the worst that we have been in the pandemic. Now, something that one of your colleagues at UAB, Dr. Nafziger, said earlier this year, I thought was really interesting, and it's a quote that I think is stuck with a lot of us. And she said, and I'm paraphrasing, that we asked for a miracle last year. We got a miracle in the form of the vaccines. So I just wanted to know, Dr. Saag, do you agree with that sentiment there? And if that is this miracle, is it frustrating to see these hospitals filling up, to see these case numbers going up when, as you said, that a lot of these are largely preventable?
Well, if we look at how vaccines are developed and created, it is a miracle. I've worked in HIV for my entire career. We've been working on an HIV vaccine since 1985, 35 plus years. Do we have one? Nope. We don't have one. And I'm not sure we're going to have one over the next decade. So we have a vaccine that was developed in 9 months, 10 months, that not only works, it works extremely well, as we've just talked about, and is safe. It is safe. It's as safe as any vaccine we use for shingles or influenza. In fact, I could argue it's maybe a little safer. Yet we are not embracing it as a society. So the fact that that was done in 10 or 11 months and released around the holiday time, around Christmas, to me, that was a miracle. That is a miracle in our lifetime. People read the Bible, they read about miracles all over the place. To me, this was another miracle, and we can choose to embrace it or not. Unfortunately, a lot of people have chosen not to. But this is definitely a miraculous thing that we have this tool available to us. We just got to use it.
Now, I'm going to get into some of these audience questions, and some of these are directed towards a specific one of you gentlemen. Some, I think that it would be beneficial to hear both of your answers. So first, I have a question, and Dr. Saag, I'm going to let you answer this one, and Dr. Harris, if you have a response here as well, please let me know. This is from Phil Kirk. Phil says, if a person is fully vaccinated, but they have maybe some high risk factors, and they get a breakthrough case of COVID, should they go ahead and get monoclonal antibody treatment?
Yes, they should. And let me describe what that is. So the monoclonal antibody is basically a product that's created to stop the virus. And if we break down what the infection is, in the first 7 days of illness from the time of onset of symptoms is what we call a viremic phase, where the virus goes in hundreds of billions of copies being produced a day. So you can see how breathing can transmit when that much virus going on. And the immune system from the vaccine can produce this antibody, but sometimes if there's underlying conditions, especially if people are on medicines, chemotherapy, or had a transplant, they may not produce enough of it to protect them. So what we do is in the laboratory or in the manufacturing plant, this antibody is made under the microscope. It kind of looks like a Y, and that business end of the antibody binds to the virus and takes it out of circulation. That shortens the duration of illness and reduces the severity. And I would argue strongly, based on the Public Health Department, Dr. Harris pushing hard, the Alabama Hospital Association, the Medical Association State of the Alabama pushing hard for this availability. That's partly why our hospitalization numbers are down. I'm sure they would be much higher if we'd not using these monoclonal antibodies, shortening the duration, reducing the severity of illness. So yes, what you should do if you have an immunocompromised state, if you have an underlying condition, you've been vaccinated, or even if you haven't, within the first day of getting symptoms, get tested. And if you test positive, call your doctor and say, am I eligible for this monoclonal antibody? And if you are, get it as soon as possible, because the earlier you get it during that viremic phase, the better chance you have of avoiding hospitalization.
Well, and Dr. Harris, you've been a very big advocate for monoclonal antibody treatment. You've really, I know, gotten the word out about that and kind of explained what that is. Lately, we have heard that there could be a national kind of shortage on monoclonal antibody treatment. Are you worried about what that could mean for Alabama, especially, again, as Dr. Saag said, that might be part of the reason our hospitalizations are not even worse?
Yeah. So you're exactly right. The monoclonals are very effective. It's very important for people to get them as early as possible. And it's really important to get them regardless of whether you've been vaccinated, like Dr. Sack said, if you're someone at high risk for getting sick. So that's not only people with chronic health problems, but people who are older, people that have, any number of things. And that's why it's so important to talk to your doctor, because they do have to be prescribed by your doctor. What we have learned in terms of Alabama's supply is that there's been a change made at the federal level that's going to change the whole process of how your hospital or your doctor or your outpatient clinic is able to access these drugs. We don't think the total amount of drug is going to go down. The formula is going to be sending drug to states based on how many cases and hospitalizations they have. And that's the ultimate good news, bad news. We have really bad case numbers in Alabama, so we probably won't have too much of a decrease in the total amount of drug. But there is such a huge demand for the drug now around the country, as cases have been surging everywhere. There's probably not quite enough to go around. So actually effective Monday night, 2 nights ago, that providers have been told that they're no longer able to directly order those medications. They have to order through public health. We're putting out guidance, well, starting yesterday, and then more guidance coming out today on how to do that. But the message for the viewers today is, if you have COVID, please, or think you have COVID, please get tested right away. As Dr. Saag said, please talk to your doctor, because the earlier you can intervene and get one of these products, the better.
And I actually had a really interesting interview with Dr. Thrasher of Montgomery. He has been really getting the word out about monoclonal antibodies. We'll leave that here for people to learn a little bit more about the qualifications, who is a candidate for monoclonal antibody treatment, and more. First, both of you, I have questions for both of you on booster shots. This was something that I had a bunch of questions on. And first, I've got a question from our sponsor, AARP. And they say that, this is for you, Dr. Harris, what is the current medical guidance for booster shots?
So, but before I try to answer that, let me make a distinction for the viewers, because sometimes there's confusion. We have already been giving a third shot to certain people. There are certain people that, like Dr. Saag just described, who just don't respond well to vaccines, to any vaccine. And it may be because they're on chemotherapy, or they have some immune system problem, or they're an organ transplant patient. Those people don't make antibodies no matter what vaccine you give them in most cases. So since July, actually, we've been authorized to give a third shot to those people, and continue to do that. Now, that's only a small number of Alabamians. It's probably about 2% of the people who live in Alabama that would fall under that category. But we don't want people to confuse that situation with what we mean when we talk about booster shots. So booster shots are what people who aren't otherwise immunocompromised in that way would get as a way to top off your antibody levels, which may decline over time the further you get out from your vaccination. So we know that the two-shot products, the Pfizer and Moderna products, have submitted data that's being reviewed right now by FDA to determine when do you need an additional shot or a booster shot. Maybe the same way you would get a flu shot every year, or you would get a tetanus shot every 5 to 10 years, or you might get a whooping cough booster shot at some point. The guidance that, or the data we have seen so far, suggests that your antibody levels do start falling around 7 or 8 months after you complete that series. You probably do have a slightly increased risk of getting infected. However, you're actually still very well protected against serious illness and against hospitalization and against death. So the answer to the question is, we're still waiting to find out what the final guidance is going to be. I'm well aware there are people out there who've already gone and asked for booster doses. But I would say that unless you're one of those severely immunocompromised people we described, there's probably no reason to get one sooner than 8 months or so after you completed your series. We're not opposed to people getting them. I would just say that I don't think that the science is quite settled on that yet, and we expect to get some guidance on that really soon.
Is a booster shot in a third dose or an additional dose, is that the same thing, or is there going to be anything different in the makeup of what we're calling a booster shot?
No, they're all identical. The first shot you get and the second shot, and if you get a third shot, additional shot or booster shot, those are all the same product. There is talk about sort of mixing and matching, among brands, and what do you do, particularly with people who got the one-shot Johnson & Johnson vaccine. Some places in the world have started doing some of that, but the best information we have right now says that you should try to stick with the product that you got originally.
If I can jump in just to add to that, we had these vaccines developed in a very fast way. We were quick, but we didn't hurry, and it was done very well. So the safety and the efficacy of the vaccines that are available are pristine. We couldn't have asked for any better. But the fast development of the products is what we're paying the cost for now, in terms of not having information about durability, how long it's going to last. That we're learning as we go. And so the discussion about boosters is being sparked by just following antibody levels and determining when they might go down. And as Dr. Harris said, the antibody levels are probably important in protecting against breakthrough infection, but you still are having protection against serious infection and death, because the rest of your immune system has what's called memory. It's been told what to do when it sees this, and it responds. As far as a second different shot, from a biologic perspective, to me, that's a great idea, because you have, with flu shots every year, we change it up a little bit to expand what we call the repertoire, so that the immune system is even broader in its response. The problem is we don't have the safety data to show that when you go from Moderna to Pfizer or vice versa, that safety is there. We don't know the range of it. We're finding out right now, but we don't know for the moment. So it's hard to recommend something that we don't have any evidence for.
And I'm glad too. This is kind of a key takeaway for people who have. I got a bunch of questions of saying the confusion between the wording booster and the wording of third dose. So meaning the same thing, I think is a good thing as well to stress. And Dr. Saag, you kind of touched on this a minute ago, but what about those people who got that one shot Johnson & Johnson vaccine? Should they just wait around for a little bit more federal guidance, or what would you suggest?
Yeah, it's a tough spot because I don't know the durability of the J&J vaccine. It seems to be pretty good. I don't think we're seeing an enormous number of breakthroughs with it, or certainly not many people with serious infection. So I think it's still working. But J&J, I know, is working on concepts of when a second dose might be given. It's following along Pfizer and Moderna, but I think it'll be there hopefully in the next month. So stay tuned.
And also a lot of questions on the flu shot. So, Dr. Saag, would you say that there is maybe a need to get vaccinated against the flu and then maybe get a third dose? Does it matter what order those two shots come in if you do choose to get a third dose?
Really doesn't matter. The idea is just to get it. We were very fortunate last year that the flu season was about as mild as we've ever seen. Part of that's because more people stepped up to get the flu shot. Part of that's because we were hunkered down a lot of last winter, wearing masks, doing all those things. I think we should do the same this year as best we can. Wearing a mask in public right now is still very important. Avoiding large crowds, still very important. And I know that we have folks enjoying football. I love football, but I cringe when I look in the stands and seeing people crowded together screaming when I know that with our current rate of infection, out of 100,000 people in a stadium, there's likely to be 700 to 1,000 of those people who are infected at that moment in time. So use your good judgment about when you go out in crowds, what type of crowds you go out in, how many of those folks might be vaccinated or not. And please wear a mask. They really work, and they will protect you and protect the people around you if you're wearing them.
Dr. Harris, what are your thoughts on that same topic? We look at football stadiums. We know at many of our football stadiums, especially in Alabama, there's no requirements for vaccination or negative tests to get in. What do you think about that?
I think you're going to have people who are at risk. We certainly believe that people who are vaccinated are at much, much lower risk. So certainly that makes you feel a little bit better. But listen, if you're getting together with, 100,000 of your closest friends, that's not going to be a good situation. Outdoor activities are a little safer than indoor activities. But, I think I have probably even more concern about football weekends with people who aren't at the stadium. There's such big social events in Alabama, and every weekend people get together and they spend hours, sitting in the den watching television in the same room. And, if you're a high risk person, especially, but anybody unvaccinated, that's just a bad place to be. And so I absolutely agree with Dr. Saag 100%. People need to be wearing masks when they're in public spaces, absolutely in all indoor spaces. There's just I can't think of any exception to that. And people need to get vaccinated as quickly as possible. The best way you can protect yourself, which means also protect those that you care about around you, is to get vaccinated. And please do that as soon as possible. If you get vaccinated today with an mRNA vaccine, you're going to need another shot in 3 or 4 weeks. It's going to be a couple of weeks beyond that until you realize the full protection of that vaccine. So, we need you to get vaccinated now so that things can look better for everyone at the end of October. Okay. If you want to have a good Thanksgiving, if you want to have a good holiday season in Christmas, New Year's, you've got to do something today. You need to do it now. You can't wait till then to take action.
Well, and we talk about football games, but there's also other events happening. There's a lot of concerts that are happening that are requiring either a proof of a negative COVID test or vaccination to get in. So Dr. Harris and Dr. Saag, do you believe that those events are safe to go to without a mask, or should you still be cautious even when you're at an event with those policies in place?
I would say that there's degrees of what's safe and what's not. The more you're around people who are vaccinated, the lower your risk, but your risk is never going to be zero. And so there are just good common sense things that all people ought to do at every opportunity. Not one of these things is an all or none thing that means you're you're never going to get infected or you're always going to get infected. They're all just different strategies. They're different layers of protection. And why wouldn't you use all the different layers of protection you have available to you? So by all means, you need to get vaccinated. By all means, you need to wear a mask. By all means, you need to distance yourself from people if it's feasible to do that. We still encourage the normal sanitation and hygiene guidelines we've done. And I wouldn't pick out any one of those and say, well, that determines your risk or not. It's all of those things. So please use common sense. If you're a high risk person because of your age or other illnesses, I personally would avoid those settings. I mean, even if you're vaccinated, I think you're just putting yourself at risk.
Let me add some information to what Dr. Harris just said. And these are just facts. Back in June, we were coming out of this. I was excited, thought we were done with it. And then Delta hit. So if we were looking around in June, I think it was a whole lot safer to go to something like that than it is now. Our rates of transmission are really pretty high, somewhere between 90 to 100 per 100,000, maybe it fluxes. But here's what that translates into in a crowd. With the rates we have today, if there are 10 people in a room, there's a chance that one of the 10 is infected is about 20%. If you go to a group of about 50 people, the chance of 1 out of the 50 being infected is well over 80%, maybe up to 90. If you have 100 people in the room, there's a 99.9% chance that 1 out of the 100 people in today's transmission rate is infected. You don't know who they are. You throw 1,000 people, 2,000 people into a concert, you can do the math and see that you're talking about at least 10 to 20 people in the crowd are infected, and they're spewing out virus. If they're singing, if they're cheering, if that type of thing, even if it's outdoors, if you're sitting in front of that person and they're spewing this virus, hundreds of thousands of copies into your direction, you breathe it. Delta's got Velcro on it. And when you breathe it in, it's going to stick and you're very likely to get infected. So use that information and make wise choices.
You made a comment, Dr. Saag, about in June. We all thought we were getting out of this. You said you were excited. I think everybody was feeling pretty good, feeling pretty excited. Delta hit, things took a bad turn, especially for those of us in Alabama with our low vaccination rates. So question for you both. We know that it seems like in the last maybe 2 weeks, et cetera, some of our rates have leveled off a little bit. Is that a false hope? Or are we really getting over this surge? Dr. Harris, I'll start with you.
I don't know. I mean, I think that the answer is we can't say for sure, but I wouldn't say we're thrilled with what we're seeing right now. You know, one thing we've learned over the past year and a half is that our predictions aren't really very good. We've seen in other parts of the country where Delta first really picked up in Arkansas and Missouri, and even in other parts of the world, like in the UK, where it seems to burn through populations in a couple of months. And so maybe that's information that we can use to predict what's going to happen in Alabama, but I'm really not confident doing that. I don't think those kind of predictions really change our advice at all. I mean, we still need people to be vigilant. There's a lot of disease out there. You know, even in June, when we thought things were better, our advice to people who are older with people with chronic health problems never changed at all. We still think those people are particularly vulnerable and need to protect themselves. With the rates we have now, I would say we'll look back at some point and decide that we got better, but I'm just not comfortable trying to predict that we are in the middle of it.
It really depends on what we do. If we all commit to getting vaccinated now, if we all go back to wearing masks, especially indoors, vigilantly, we do it all the time, we can bring it under control. Those reductions that we're seeing in Great Britain with Delta and in India were changed. The outcome was the way it was because people changed their behavior. In India, they went more to lockdown. I'm not advocating that, but at least they did something. We're almost doing the opposite right now collectively. We're trying to get back to normal, and it is not normal. So just if everyone could just be a little patient, make wise choices, protect yourself and your family, we can get through this with the least amount of damage. But right now, we're not doing a great job, I'm afraid to say.
Dr. Saag, how do we get back to normal? We know, I've got several questions. This is one from Deborah. She says, considering the low vaccination rate, which is, in her words, unlikely to change, the lack of any type of rules regarding mask mandates, et cetera, and unavailable ICU beds, hospitalization rates, what is Alabama going to do to pull itself out of this situation?
Well, it really is up to us. I'm not sure I agree with the caller or the viewer that we're doomed to just have a bad outcome. We're in control right now. If we choose to get vaccinated at this moment, we will make a difference collectively. And the numbers are coming up. Tip of the hat to folks for the last month. We've done better in vaccination. And every vaccine, every person that gets vaccinated helps a lot when you put it all together. We just got to do a little better right now. And wearing the mask, there's no controversy about this. Masks work. They work. You know, you wouldn't want me operating on you in an operating room if I wasn't wearing a mask and I'm breathing and into the wound. I'm going to have a wound infection and I operate on you. Why do you think surgeons wear a mask? It's because it reduces the spread of infection. That happens with COVID as well.
Dr. Harris, any thoughts to add?
Yeah, I would just add, I do agree that it's not inevitable that we continue to have low rates of vaccination. Alabamians are finally coming around. You know, it's taken a while, and I think as people have a personal experience with this disease and they know people who are involved, or maybe they're affected themselves even, that's when they maybe sometimes get spurred to act. So it's encouraging to see where we are. We're actually not completely at the bottom. We have a long way to go, but I think this morning we were ahead of 8 states in terms of first shots. We're ahead of 3 states in terms of fully vaccinated citizens. So that's, you know, you can't be number 1 until you get to be number 42 first. So I hopefully we're headed the right direction.
I remember you saying a quote that was just like that maybe a few weeks ago, Dr. Harrison. It made me laugh because it's so right. You don't move from 50 to 1 in a day. You have to work your way up. We do know that vaccination rates, especially that first dose, have gone up recently in Alabama. That can probably be attributed to a lot of different things. But just in a data question, Dr. Harris, is there a place where the Alabama Department of Public Health is planning to log the number of people who have gotten 3rd shots, or when things are calculated as they have been from fully vaccinated, will the people that have gotten 3rd shots still live in that group of fully vaccinated?
Yeah, that's a great question. So we're actually having those discussions about just about the best way to present the information. So right now, the numbers that you see will show the total number of shots that we have given. You can see that on our dashboard, but you can see the total number of individual people who've had at least 1 shot, and then the total number of people who are fully vaccinated. And right now, that's based on 1 dose of J&J or 2 doses of the 2 mRNA products. We'll probably have to revise the definition at some point just so we can break that data out. But we just haven't figured out a way to do that right now. If at some point we believe that 2 shots is not enough for you to then be considered fully vaccinated, obviously we'll adjust that definition accordingly.
And also, data question, we know right now most of our hospitals, when they release information about their COVID-19 patients, they kind of break it out by saying these are the amount of people we have that are not vaccinated. These are the amount of people we have that are vaccinated. Is there any sort of plan to say, well, we have these people fully vaccinated that have gotten a 3rd dose? Or do we believe right now that there are any people hospitalized who have received 3 doses?
Yeah, so I'm not aware of any data that would tell us that. It may be that we could search and figure that out. There's just no recommendation right now for 3rd doses, so I'm not quite sure that we could be comfortable in presenting that data. I'm not sure we'd be comfortable with the accuracy of that data. Look, we're clearly going to have more breakthrough infections as we get more people vaccinated. And I think that's a concept sometimes that people can't understand easily, or sometimes people distort on purpose. But if you have a vaccine that's 90% effective, or maybe with Delta, perhaps maybe 80% effective, now we've vaccinated around 2 million Alabamians. So it would be totally in keeping with everything we expect if we had several 100,000 breakthrough infections occur. Now, those people are really at low risk for being seriously ill. They're getting hospitalized, and there's almost a no risk for dying. But sometimes I think people point at breakthrough infections if they're already a little skeptical about getting vaccinated, and they go, well, look, those people got sick anyway. That's totally in keeping with what we would expect. If we did not have almost 2 million people fully vaccinated, I can't imagine. I don't think we'd be functional. I can't imagine our hospitals could even remain open.
Dr. Saag, in keeping with these vaccine questions, I have one for you, and I think a lot of people probably fall in this boat. This is from William, and he says that he had a very severe reaction to his first dose of the Moderna vaccine. He said he kind of described his symptoms. He said this lasted for about a week, and he said he had kind of a slow return to normal. He did not go get the second dose of Moderna. So now he's asking, what should I do? Should I go get a J&J? Or should I just take my chances with that one Moderna vaccine? Or should I just kind of buck up and get that second Moderna shot?
Yeah, the reactions are more significant, severe for people who had prior COVID, like me, and then I got a vaccine afterwards. My reaction was intense as well. I had Pfizer, and so I elected to delay my second shot just on my own. Checked antibodies in a research lab. And I have received the second dose, and I got a significant reaction again, but I'm sure that's my immune system saying, you got this, and that's good. I'm not saying there are no deaths, but there are very rare situations where somebody from a reaction to the vaccine would die. And I think we got to make that perfectly clear, on the order of really small risk. But the benefit of protecting against COVID is enormous. And so what I would say is that every time we consider, do I get a vaccine or do I not, we're really not asking the question yes, no. We're saying, what's the risk of a side effect and long-term complications from a vaccine versus what's the risk of a side effect and a long-term complication due to actually catching COVID? And there's no comparison. Yes, you might get a little sick with the vaccine, but you can get a lot sick with COVID. Not guaranteed, but certainly much more frequently than anybody gets a side effect from the vaccine. And as we've seen, people in the ICUs, almost 90% are unvaccinated folks. And in the 10% who are vaccinated are most of the people we've already talked about who have immunocompromised states, transplant patients, chemotherapy folks whose immune system is not normal. And so they don't have the full armamentarium to fight the infection as a normal host would have. So that's really what we're talking about, the risk of a vaccine versus the risk of the disease. And one final point, keep in mind that about 8 to 10% of people who have COVID, even if it's mild, get something called long COVID, where their symptoms persist for weeks to months later. That could be shortness of breath, fast heart rate, brain fog, GI problems, heart problems. And these things are real and plague a lot of people and cause some disability. That can be prevented in a large way by getting vaccinated.
I'm glad you mentioned that because that was where I was going next. And Dr. Saag, I know that you have been very vocal about your experience with COVID. Actually, the first show that I did a year and a half ago was with you. And by the end of it, this was right when lockdown had started, you were coughing really badly. And I think I even had to mute you at one point because you were really struggling. Well, then you have been, again, vocal about your experience with COVID and outspoken about that. So I have a question from Zaza. And Zaza asks about your opinion on long haulers COVID and any advice you would give to people suffering with that.
Well, of course, I'll go back to my last point and say that it's best not to get COVID. But for those of us who have had COVID and get these long-term symptoms, it's a mystery, I've got to say. And it's frustrating as doctors. It's extremely frustrating for a patient because I have some folks who have what's called long COVID who just walking into the shower or going to the mailbox, their heart rate goes to 160. And it's unexplained. I don't know why that is. We don't know why it is. I can make a lot of guesses, but bottom line is we don't know what it is. And in medicine, when you don't know what's causing something, it's hard to come up with a treatment. And you try different things and sometimes they work, but really all we're doing right now is treating symptoms and keeping our fingers crossed that whatever is causing this goes away. And some people it does, and too many people it doesn't. And so there's a lot of heavy research going on right now to define what causes these long COVID symptoms. But the bottom line answer right now is we don't know. And my final point is that we are so spoiled in a good way, I guess, by how much modern medicine has accomplished in the last 50 to 60 years. We get sick with something, you go to the doctor, they know what to do, they give you a prescription, you get better. That's because of 50 to 60 years of research that's told us what causes something and what to do. We're a year and a half into a pandemic, we know what causes it's a virus, but we don't know the immune system responses that well. And we're suffering, a lot of people are suffering until we learn more.
Dr. Harris, anything to add there?
No, I agree completely. I think the real issue is that we just don't know enough right now. It's incredibly frustrating for people who have come through this acute illness of COVID to still have these symptoms that linger on. There are other types of infectious diseases that we know about where people have these sort of long-term symptoms, and we're not always quite sure how to characterize them. And a lot of times we don't really know well how to treat them. And so, maybe this is similar to what we've seen with other types of diseases, or maybe this is a unique phenomenon related to COVID. I'm not sure that I know the answer to that, but I would just say, please hang in there. There's more data being released every day. There's more studies going on all the time about this. We certainly hope eventually we'll have enough information that we can really intervene and help people get over this.
Dr. Harris, we know that when vaccines first came out, there was a really large and involved statewide effort of getting vaccines to people maybe who were in parts of rural Alabama, those who were homebound or in nursing homes, et cetera. So a question also from our sponsor, AARP, what is the Alabama Department of Public Health's plan to deliver that third dose to people that are maybe homebound or in long-term care facilities?
Yeah, so that's a great question. So we want to obviously make sure that vaccines are available to everyone. And actually, with the provider network that we have set up over the past year or so, past 9 or 10 months, we actually do have vaccines that are pretty widely available everywhere. Every county in the state has multiple locations to get a vaccine. In most cases, you can get it on any day of the week, in most cases without an appointment. And so as we see a need for additional doses, we certainly will consider doing that. I'll remind you that if and when booster doses become recommended, probably it's going to be offered after some timetable, like 8 months after your second shot, or maybe 7 months or 9 months or whatever that works out to be. So that's going to mean it is going to be a staggered approach. We're not going to have all 2 million Alabamians all eligible to get a booster dose on the same day. If you remember the very first month that we were doing vaccinations back at the end of December, 1st of January, those were, largely nursing home residents and people who work in healthcare facilities. So when booster doses become available, that'll be our priority group because they'll be the first ones who are going to be eligible. Our next eligibility group were seniors. There were certain groups of first responders, people with chronic health problems, and so on. So it should be a staggered thing. I don't expect that we're going to have, enormous drive-through clinics with people waiting in cars for hours to get booster doses, particularly since we have now about 1,450 locations around the state where you can get vaccines, which includes just about every chain pharmacy, many independent pharmacy, many doctor's offices, federally qualified health centers, urgent care centers, hospitals, you name it. There's so many places to get one now that we're just don't have the same concern about people having access that we did then.
I have a question for both of you, and this really centers especially on an email I got from somebody who told me about their 22-year-old son and about how their son is getting infusions of a certain medication each week to suppress his immune system for a pre-existing conditions. And this person said that my biggest fear comes from not knowing if he would be able to mount a sufficient immune response if he got COVID. And I'm sure that there are people across the state, across the world, really, who are having this same feeling. Now, I want to ask both of you, Dr. Saag, I'll start with you because you mentioned it a few minutes ago of, well, we know that a lot of people who are getting sick maybe have suppressed immune systems, such as this person who sent in this thought, people maybe who are going through chemotherapy, organ transplant recipients, et cetera. What does it feel like for both of you as healthcare professionals and just as Alabamians in general when somebody says, well, yeah, people are getting sick, yeah, people are dying, but they're immunocompromised or they're obese or they're older? What does that make you feel like, Dr. Saag?
Well, to me, I believe in a collective society. I think we're all in this together. And we have an obligation, in my opinion, not only to look out for ourselves, but to look out for our fellow citizens. That's who we should be, who I think we are a lot of the times as a society. So if we ask the question, even if I'm normal host, I have, in my opinion, somewhat of an obligation to look out for my brother or my sister and try to help them and protect them as best I can. The way we can do that is by exercising choices that protect not only ourselves, but them. And to me, that means getting vaccinated. To me, that means wearing a mask when I'm out in public while we have this degree of high transmission. Another common commentary is that I have choice, I have freedom, I have liberty, I can choose whether I get vaccinated. And that is true. On the other hand, if my choice of exercise of liberty and freedom has an impact on the person sitting next to me, then it imposes on their liberty and freedom to live and to breathe and to avoid infection. I think that's where we start to hit the wall in terms of limits of what liberty and freedom are. And there's lots of examples of that in all of our laws. We require vaccines for kids to go to school. We require seatbelts to protect people from getting injured. And we also even restrict smoking in some establishments to keep people from suffering from secondhand smoke if the person, for example, next to you, if you're smoking, might have lung disease. I think we just need to hit the pause button on some of the energy around these conflicting debates and just ask the question, how can I help myself and how can I help my fellow citizen? And if we just take a moment and reflect, we can do a lot better. So that's my plea to everyone, is not just think about yourself and your own personal stuff, but understand that by any of us choosing to not get vaccinated, we are having an impact on other people, be it by transmitting to them, or perhaps if we get sick and go into the ICU, blocking up beds where somebody else trying to get into the hospital with an illness can't get in because the beds are filled. If everybody were vaccinated right now, our hospitals wouldn't be clogged. That's a fact. That's just a fact. So that's what we can do to help ourselves and other people.
Dr. Harris, same question.
Ivana, ultimately we do just have to care for other people, and it doesn't matter if they're older or if they have other chronic health problems. We should care about other people. You would think that you don't have to explain that to adults. That's a lesson, you kind of learn when you're kids. But of course, we have compassion for everyone. We want to take care and protect everyone that we can. Now people have the right to make their own decisions, absolutely. But as Mike said, that right really ends when you're talking about an infectious disease that you are spreading to other people. We allow people to do what they want, but not to the extent that they can still harm other people. Smoking is a great example. You can smoke as much as you want. You can't stand in a crowd of people in a public space and blow smoke on them. We don't tolerate that. That's the best example I know related to the pandemic. I want to give you one stat that we probably should have promoted more. This past year in Alabama, the year 2020, for which we kind of have the final numbers almost, we're going to have more deaths in the state of Alabama than we have ever had in any year in the history of the state of Alabama, by a lot. We're going to have around 6,000 or 7,000 more people who died in our state this past year than any year we have ever had, going back to the year 1900. That's how far I've asked our staff to look back. So this past year is the first year in the history of Alabama that we've had more deaths in our state than we have had births in our state. Our state actually shrunk last year. And, it's not a coincidence. That's about exactly the number of deaths we had from COVID. We get skeptical people who go, oh, well, those were just old people who were going to die anyway, and you're just attributing their deaths to COVID. That is not the case. Well, we had 6,000 or 7,000 COVID deaths last year. That's about how many excess deaths we had in our state last year. And again, our state literally shrunk this past year for the first time in history, even going back to World War II when people were serving overseas, going back to the Spanish flu epidemic, when we had the flu in the state, going back to World War I. We've never seen that happen before in the state of Alabama until COVID this past year.
And when the numbers come out for 2021, there probably, I would guess, might not be as many total deaths. But the tragedy of 2021 is that the majority of those deaths were totally preventable. We didn't have a vaccine in 2020. We do have a vaccine now. And the people dying, 90 to 95% plus, are unvaccinated folks. And that is, to me, an enormous tragedy unfolding before our eyes right now.
Important message to end on. Dr. Harris, Dr. Saag, thank you both so much for taking time out of your busy days. I know that you are both swamped, so we appreciate you taking that time to answer our questions. We appreciate it. Everybody watching, thank you so much. Please be sure you come back next Wednesday at 11 a.m. for the third installment in our COVID-19 Town Hall series presented by AARP of Alabama.